we also need to work on those attitudinal barriers and address the misconception that everything is related to someone's disability, including mental health, because that often gets assumed. Happy Monday, everyone. I hope you had a great weekend, and I am happy to welcome you back to another episode of NC Chats. This is my fourth time recording this because my computer wasn't picking up sound. So let's hope it works this time. So today I wanted to talk about the intersections and interaction between the healthcare system and people living with disabilities. More specifically, I want to share from the point of view of someone living with a physical visible disability in which typical procedures are a little bit more difficult due to my spasticity. Mainly because that's my lived experience and I don't want to speak on behalf of others. However, I will say that many of the things I touch on today, I have heard from others who have invisible disabilities or any other pre-existing conditions. So, on that note, let's jump on in. Yay! So, I think there are two main challenges to being a patient living with a disability. I also, down the line, want to talk about being a caregiver living with a disability, but that would be a long video to do both, so we'll stick with the patient perspective for now. The first is many doctors and nurses and medical professionals often don't really know how to interact or treat someone with a disability. And this honestly is not really their fault, I guess, necessarily. So, historically, someone with a disability such as mine that was acquired as a child someone like me wouldn't often have lived into my adult years just because there was often a lack of resources, medication, supports, and understanding of what people with disabilities were capable of. So, not even way back, even back in the 70s, I think the 80s even, someone with my level of CP probably would have been placed in a group home or institutional setting and not encouraged to live a full, meaningful life. Obviously, that has changed, which is awesome. But that also means many of us are living a lot longer and needing more medical care because, like all people, as we get older, we start to acquire different illnesses sometimes. So, a lot of the medical professionals I have met often don't know how to do even basic tests on someone like me. For example, when I went to the ER because I ran over my own foot with my power chair, I'm incredibly talented. Um, they tried to put that finger thingy on my finger to test my pulse. Obviously, you can tell just by the camera that my fingers and hands don't really stop moving. So I wiggled that off in about 2 seconds, and they didn't know how to check my pulse. Um, Someone figured out you can use the earlobe. So good tip to know if anyone needs that. Use your earlobe for that clamp thingy. But it is concerning because if even basic tests can't be done accurately, how do I know how healthy I am? I mean, I know how I feel, but am I actually healthy or is something being missed? And that kind of ties into the second point I want to talk about today. And that is the tendency for healthcare providers to kind of connect every symptom you ever feel to your disability automatically. Oh, you have a sore knee? It's your CP. You have trouble breathing at night? It's CP. You are growing a horn out of your forehead? It's probably CP. Um, that, that's how it feels at least. And it really concerns me because, again, if you're not doing a test and figuring out what's actually going on with my body, how do I know I don't have something that needs treatment now before it becomes a significant concern? Um, so, and also, I mean, I had a doctor who, when I went in, she asked what was wrong with me. I had a sore ear and said that. She asked, no, what's wrong with you? Meaning my disability. And if you want to know about someone's disability, asking what's wrong with the person is not the best way to go about doing that, so I don't recommend doing that. And B, my ear infection had nothing to do with my CP and or the treatment of the ear infection. So those situations can be frustrating and concerning. So all that is to say, I feel healthcare professionals, there's an easy fix, and they should just be provided more education on supporting patients with disabilities and finding creative ways to do tests and treatment and meet their needs. That's an easy win. Um, and then we also need to work on those attitudinal barriers and address the misconception that everything is related to someone's disability, including mental health, because that often gets assumed. Like, oh, you have CP, you must be unhappy because of that, and that's why you have depression. not always true. So, education, education, education. I'm going to leave it at that. I hope you enjoyed this video. I would love to hear your thoughts in the comments below. If you did like it, give us a thumbs up. I'm doing it. If I can do it, you can do it. Um, and don't forget to subscribe to see our content next week. Thank you, everyone. I hope you have a wonderful week ahead, and we will see you along the way. Bye.